I want to talk about what the addictions are all about, what the state of the art is, and the state of knowledge is about addictions, because it's a moving, changing field, and right now, most of the society really doesn't understand what's going on, much less be at the cutting edge. So what's the cutting edge? Well, how did things start? Things started out as addictions were, addicts were people with a sick soul, and they had to basically get their souls in shape and get involved with the spiritual connection and heal from that point of view. The church was basically the stalwart institution to deal with the addicts, and of course they had their spin on it. Eventually, the medical community decided that maybe we ought to get involved with addictions, and maybe it's a medical issue, and then you had the medical establishment coming in, and then you started hearing about the disease concept of addiction. And no one ever said what exactly the disease was. Was it a germ? Was it a hereditary disease? It sort of went back and forth, and nobody ever put a label on it, but they liked the idea of disease because it got away from the idea of this is just a bad person. Now, the disease concept is accurate, and we're beginning to understand what the nature of the disease is. In the brain, going from one neuron to the other is a chemical that's released, a neurotransmitter, and it lands on a receptor. Now, if that receptor is damaged for whatever reason, then the disease is because of the damaged receptor. So addictions, as it's seen now, is a receptor disease in the brain of these neurotransmitters. So you've got to deal with the receptors. When you have receptors affected, you have personality changes, you have behavioral changes, everything that you see, cravings, whatever. But you've got to go to the cause of this, which is what's happening at the receptor level. And that's where Suboxone comes in, hits the mu receptor, corrects the dysfunction, and then you have to start from there, because you've got a full brain of 150 different receptors, many of which are very out of whack. So what do we have? We have from a sick soul model of addictions to a disease model with the receptors there as the disease entity. And Suboxone is the first major advance in addictionology